Welcome to the Ministry of Health's Week in Review. Here's a look back at some of this week's key events and accomplishments across the health sector. On October 18th, the Honorable Minister of Health Dr. Frank Anthony attended an appreciation dinner celebrating the 48th anniversary of the Medical Extension Officers in Guyana. The event recognized the invaluable contribution of medical extension officers to the nation's healthcare system, particularly their roles in ensuring that quality healthcare reaches remote and underserved communities. Minister Anthony thanked the officers for their decades of dedication, describing them as vital links in the delivery of primary health care. He reaffirmed the ministry's commitment to their continued professional growth and well-being. On October 20th, the Ministry of Health's NCD's program hosted a tobacco cessation CME session. This session brought together health professionals from across Guyana, equipping them with skills to strengthen tobacco cessation services within the public health system. The minister, in his remarks, highlighted Guyana's progress since adopting the WHO Framework Convention on Tobacco Control and enacting national tobacco legislation in 2017. Noting that tobacco cessation clinics are now operating in 11 locations across the regions, 3 and 4, with plans to expand to all regions. On October 24th, 38 individuals graduated from the Ministry of Health's Health Sciences Education Division's Patient Care Assistant Program in Region 5. These graduates are now equipped with the skills to provide direct hands-on patient care under the supervision of nursing staff. Their training covered areas such as infection control, basic nursing care, communications, and healthcare ethics. Now let's hear from two patient care assistants about their experience.
I am Stacy Porter and I am from a small village called La Villas, and that village is located in region number 5. Today I'm standing here as a proud patient care assistant. Also, since I was a child growing up, I would have liked to venture out into the medical field because I always see the necessity of assisting persons back in my community with chronic illnesses. Added to that, I would like to thank the government of Guyana for affording us the opportunity to do this program. On behalf of myself and colleagues, we are happy and we are looking forward to moving upward.
My name is Ledon Roberts and I am from Maikoni. I had completed the patient care assistant course. By working at the hospital on the part-time, I was inspired by some nurses that I should join the nurses field. I feel wonderful that I completed the course. It wasn't easy. The first 2 months was nice for me in the health field, completing the program. The second 2 months, I lost my mom, so it wasn't easy from there, but I still pulled through and completed the course by God's grace.
On October 25th, the Minister of Health reaffirmed the government's commitment to advancing oral and dental health services nationwide as he addressed professionals gathered for the 2025 Dental Auxiliary Conference under the theme Building Thriving Dental Practices for the Future. The event brought together dental practitioners and stakeholders to discuss innovations and challenges in the sector. Minister Anthony highlighted major progress in modernizing oral health services, including the transformation of the Chelly Jylland Dental School, which now features modern equipment, improved clinical spaces, and an in-house pharmacy.
So I want to congratulate the Dental Department, Dr. Mays and his team for organizing this. Over the last couple of years, we have been working to improve dentistry and oral health in Guyana. At one time, I believed that dentistry and oral health was something like a stepchild in the industry. So while we were doing it, we weren't doing it on scale. Many of the regions did not have the facilities. We did not have enough people that we were sending out, a whole host of other problems. But we want to change that. And we'll be working steadfastly to improve the infrastructure that we have. And you would have noticed that throughout the country, we have been working on improving infrastructure.
On October 26, Minister Anthony extended congratulations to 22 new pharmacy graduates during the white coat ceremony held at Carr Lodge. The graduates, having completed their studies and internship, are now officially licensed to practice. The minister urged them to seize emerging opportunities within Guyana's growing healthcare system, noting that they are entering the field at a very transformative time.
We want to ensure that by maybe 2030, that we can eliminate leprosy from Guyana. While we are working on these diseases, we have also added additional things to the portfolio of what we want to eliminate. We feel that Hep C, that we can actually eliminate Hep C from Guyana.
Those were the words of the Minister of Health, Dr. Frank Anthony, at the PAHO WHO Sub-Regional Leprosy Training Workshop. Participants from 8 countries engaged in the theoretical sessions, clinical practice, and laboratory training aligned with the global leprosy elimination goals. Also on October 28, Minister Anthony welcomed the 21st Chinese medical team during a courtesy visit at his Bergdam office. The 18-member team comprising specialists in internal medicine, surgery, pediatrics, obstetrics and gynecology, ophthalmology, traditional Chinese medicine, and public health shared details about their upcoming service in Guyana. That concludes this week's edition of the Ministry of Health's Week in Review. Remember, early detection is key. Get screened for breast cancer today.